Hi, my name is Ratinder Kaur and I'm in class BSN 346 and section 3. I am making a video on what to avoid during pregnancy. So the food that is avoided during pregnancy is very necessary for the mother's and the fetal's well-being. The food that needs to be avoided is raw, pasteurized, undercooked meat, eggs, hot dogs, deli meat, high mercury fish like sushi, and raw sprouts. All of this food is actually avoided due to being high in mercury. It can contain E. coli, salmonella, so it has higher chances of giving infection and causing miscarriage. Over-the-counter medication that is okay to use while pregnant is Tylenol, cough drops, honey but in moderation, antacids like Tums, saline nasal spray. So these medications are okay to use if you are having some heartburn, some fever, some mild pain. The over-the-counter medication that need to be avoided is NSAIDs like ibuprofen, aspirin, decongestants, Pepto-Bismol, because of the risk of bleeding, hemorrhaging, and it can make the bleeding worse than what it was before because aspirin is a blood thinner and NSAIDs are linked to premature births. And the vitamins that are recommended during pregnancy is prenatal vitamins, which contains DHA, calcium, iron, folic acid, which is all necessary. Oh, also vitamin D. It's all necessary for the fetal health and the mother's. It all provides nutrients, prevents neurotubal defect, avoids anemia, and then vitamins that can be avoided is vitamin A, E, and any herbals like ginseng, because they can cause bleeding, they can cause St. John warts. To avoid is St. John warts, because they can all cause a birth defects and uterine contractions. Environmental things to avoid during pregnancy is pesticides and chemicals, lead and paint fumes, secondhand smoke, because they can all cause birth defects. Exposures can cause like cognitive impairments, premature birth. It can cause miscarriage. Alcohol and tobacco use is not permitted during pregnancy or any other drug substances, because it can cause it can cause birth defects, developmental delays, deformities, facial deformities in the fetus, and low birth weights. In pregnancy, to travel, it is safe to travel during the early times of pregnancy, from like second trimester. It's safe because morning sickness is it's not that bad. Preterm labor risk is actually lower. Preparation, you can carry prenatal vitamins, your medications, always wear seatbelts, lower across the hips, and then always stay hydrated. And then of course avoid travel during your late pregnancy trimester, anywhere after 36 weeks. because you're more closer to having labor contractions or pre-labor. And then always avoid travel to a country to where they are more prone to have Zika virus or malaria, because it can actually cause birth defects. And then always avoid travel during like unsafe times or risk, and always avoid traveling to regions where it takes a very long hours to get there because of the risk of like prolonged sitting. As a pregnant mother, you need to be up and walking, and because it can have a risk of developing a DVT. And then when to visit a dentist is the best time is to like a second trimester. It's good for cleaning, it's good for any type of like a minor dental procedures. Dental x-rays are okay, they're safe as long as they are using the abdominal, sorry, I'm having a blank, abdominal shielding is used. Local anesthetics are okay, such as lidocaine. And the common issues that can happen during pregnancy is pregnancy gingivitis, bleeding gums, tooth decay, and then periodontal diseases. And these, so having a good proper hygiene and mouth, like oral hygiene, is important because it can create gum infections, and it can be sometimes they are linked to premature birth. And this is it with the video, and thank you.